I'm Dr. James Wilson, and if you or someone you love is over 60 and taking daily medication, I want you to stay with me for the next few minutes, because what I'm about to share could genuinely prevent a hospital visit. Every week in my practice, I see the same story play out. A patient feels better, their blood pressure looks great, their mood has stabilized, their joint pain is gone. And so, quietly, without telling anyone, they stop taking their medication. Sometimes it's because they run out and figure they'd skip a few days. Sometimes it's the cost, especially for people managing multiple prescriptions on a fixed income. Sometimes it's a pharmacy mix-up, a hospital stay that disrupted the routine, or simply forgetting because the pill bottle got buried behind 3 others. And sometimes it's a deliberate choice, because they just don't like the idea of being dependent on a pill. Whatever the reason, the pattern is the same. It usually doesn't feel dangerous in the moment. Most of the time, nothing bad happens right away, and that false sense of safety is exactly what makes this so risky. The body doesn't always announce a problem immediately. It can take days, sometimes weeks, before the underlying effects of stopping catch up. For 6 specific categories of medication, stopping suddenly, even for a few days, can trigger something far more dangerous than whatever the medication was treating in the first place. I want to be upfront about something before we go further. This isn't about scaring you into taking more pills. And it's not a blanket statement that everyone needs to stay on every medication forever. Doctors regularly and appropriately reduce or stop medications in older adults too, especially when a drug is no longer helping, when side effects outweigh the benefit, or when a person's health goals change. That process even has a name in medicine: deprescribing, and it's a completely normal, healthy part of aging well. The point of this video isn't never stop. The point is never stop these particular 6 on your own without a plan. There is an enormous difference between a doctor-guided taper and simply not refilling a bottle. Let's walk through each category, what it actually does in your body, and why your body needs time to adjust when it goes away. The first category is beta blockers. You might know them by names like metoprolol, atenolol, or carvedilol. Doctors prescribe these for high blood pressure, irregular heart rhythms, and for people recovering after a heart attack. Here's what most people don't realize. Beta blockers work by essentially turning down the volume on your body's stress hormones, adrenaline in particular. Your heart and blood vessels adjust to that lower volume over time. If you stop the medication abruptly, your body doesn't quietly go back to normal. Instead, it can overcorrect. Adrenaline receptors that were dialed down suddenly become more sensitive again, and the result can be a rebound effect: blood pressure spiking, heart rate racing, chest pain, and in people with existing heart disease, this rebound has been linked to an increased risk of heart attack. Cardiologists call this beta blocker withdrawal syndrome, and it's a well-documented phenomenon in medical literature. The safe way to come off a beta blocker, if that's ever medically appropriate, is a slow taper over 1 to 2 weeks, monitored by your doctor. Never a cold stop. The second category is blood thinners, also called anticoagulants. This includes warfarin and the newer generation of drugs like apixaban, rivaroxaban, and dabigatran. These are typically prescribed for atrial fibrillation, after certain surgeries, for blood clots in the legs or lungs, or for people with mechanical heart valves. The reason these medications matter so much is straightforward. They are preventing your blood from forming clots that could travel to your brain and cause a stroke, or to your lungs and cause a pulmonary embolism. Unlike some medications where the risk of stopping builds up gradually, with blood thinners the risk can appear within days. Your clotting system returns to its normal, faster state almost immediately once the medication clears your system. But the underlying condition that put you on the blood thinner in the first place, the irregular heart rhythm, the clot-prone vein, hasn't gone anywhere. This is one of the most common reasons for what doctors call a rebound thrombotic event. And it's a leading cause of preventable strokes in patients who stop their anticoagulant without medical supervision, often because of a scheduled dental procedure or minor surgery where they weren't properly bridged onto a different regimen. If a doctor or dentist ever tells you to pause a blood thinner, always confirm the exact restart date and get it in writing. The third category is corticosteroids. Medications like prednisone, prescribed for everything from severe allergic reactions to autoimmune conditions like rheumatoid arthritis, lupus, and inflammatory bowel disease. This one works differently from the others, and it's arguably the most dangerous to stop abruptly if you've been on it for more than a couple of weeks. Here's why. Your adrenal glands naturally produce cortisol, a hormone essential for regulating blood pressure, blood sugar, and your body's response to physical stress. When you take corticosteroids regularly, your adrenal glands sense that cortisol levels are already high and they scale back their own production. If you stop the medication suddenly, your adrenal glands can't immediately ramp back up to compensate. This can lead to something called adrenal insufficiency, or in severe cases, adrenal crisis, a genuine medical emergency involving dangerously low blood pressure, severe fatigue, vomiting, and confusion. This is precisely why doctors always taper corticosteroids gradually, reducing the dose in small steps over weeks, sometimes months, to give the adrenal glands time to wake back up. If you've been on prednisone or a similar steroid for any extended period, please never stop it on your own, even if you're feeling completely fine. The fourth category is antidepressants, particularly SSRIs like sertraline, escitalopram, and paroxetine, along with SNRIs like venlafaxine. These medications work by gradually changing the balance of serotonin and other neurotransmitters in your brain. Your brain adapts to that new chemical environment over the weeks and months you're on the medication. Stop suddenly, and you can trigger what's officially recognized as antidepressant discontinuation syndrome. Symptoms typically show up within a few days and can include dizziness, flu-like body aches, nausea, irritability, vivid or disturbing dreams, and something many patients describe as brain zaps, a brief electrical shock sensation in the head. For seniors, discontinuation syndrome can be particularly disorienting and is sometimes mistaken for a new illness or even early cognitive decline, leading to unnecessary worry and additional medical testing. Beyond the physical symptoms, stopping an antidepressant abruptly also removes the underlying treatment for depression or anxiety, and relapse of the original condition is common. If you and your doctor decide it's time to come off an antidepressant, the standard approach is a gradual dose reduction over several weeks, sometimes longer for medications with a shorter half-life. The fifth category is benzodiazepines, medications like alprazolam, lorazepam, diazepam, and clonazepam, often prescribed for anxiety, insomnia, or muscle spasms. This is one where I want to be especially clear, because the withdrawal risk here isn't just uncomfortable, it can be life-threatening. Benzodiazepines enhance the effect of a calming neurotransmitter in your brain called GABA. With regular use, your brain adjusts its own chemistry to compensate for that enhancement. Stop abruptly after weeks or months of use, and your brain is left without enough natural calming activity, which can result in severe anxiety, tremors, and in more serious cases, seizures. This risk is well established in addiction medicine and geriatric care, and it's precisely why any benzodiazepine taper needs to be slow and medically supervised, sometimes over the course of many weeks. Older adults are also more sensitive to these medications generally, which makes an unsupervised stop even riskier. If you've been taking one of these regularly, please don't attempt to quit on your own, and don't let anyone convince you that willpower alone should get you through it. This is a physiological dependency, not a character issue, and it deserves a proper medical taper. The sixth and final category is statins, medications like atorvastatin, rosuvastatin, and simvastatin, prescribed to lower cholesterol and reduce cardiovascular risk. Statins work differently from the other 5 categories on this list, because there is no dramatic withdrawal syndrome in the same way. But here's what's important. Research has consistently shown that abruptly stopping statin therapy, particularly in patients who have already had a heart attack, stroke, or who have established cardiovascular disease, is associated with a meaningfully higher risk of a future cardiovascular event compared to patients who stay on therapy or transition off gradually under medical guidance. Part of this appears to be due to a rebound in inflammation and a rapid return of LDL cholesterol to pre-treatment levels. Some patients stop statins because of muscle aches, a genuine and fairly common side effect, and I want to acknowledge that concern is legitimate. But the solution is never to simply quit and hope for the best. Your doctor has several options, including switching to a different statin, adjusting the dose, or trying alternate day dosing, all of which can often resolve the side effect while keeping you protected. It's also worth knowing that not everyone needs to be on a statin indefinitely. And for some older adults, particularly those with limited life expectancy or significant frailty, a doctor may reasonably decide the benefits no longer outweigh the burden. That's a legitimate medical judgment. What's not appropriate is making that call yourself in the pharmacy parking lot because a friend told you statins are bad for you, or because of something you read online that wasn't checked against your actual health history. I also want to spend a moment on a theme that connects all 6 of these categories, because it explains why abrupt stopping is so different from a planned change. Your body is constantly adjusting to whatever chemical environment it's given. Give it a medication every day for months or years, and your organs, receptors, and hormone systems recalibrate around the assumption that the medication will still be there tomorrow. That recalibration is invisible. You don't feel your adrenal glands scaling back cortisol production, or your beta receptors becoming more sensitive to adrenaline, or your brain adjusting its serotonin balance. It happens quietly, in the background, which is exactly why the consequences of suddenly removing the medication can catch people so off guard. A slow taper works because it gives those same invisible systems time to recalibrate back in the other direction gradually, instead of all at once. So what should you actually do with all of this? First, if you are on any of these 6 categories of medication, make a simple list of exactly what you are taking and why. It sounds basic, but you'd be surprised how many people can't answer that question clearly when asked. Second, if a medication is causing side effects, expensive, or you simply feel like you don't need it anymore, bring that concern to your doctor directly, rather than making the decision alone. There is almost always a safer path forward, whether that's a dose adjustment, a switch to a different drug in the same class, or a properly paced taper. Third, if you are ever hospitalized or see a new doctor, bring your full medication list with you, because gaps in communication between providers are one of the most common reasons medications get stopped by accident. And finally, if you're a caregiver for a parent or spouse, this is worth a direct conversation. Ask them plainly whether they've been taking everything as prescribed, and if they mention skipping doses, treat that as a conversation starter with their doctor, not something to brush aside. A few more practical habits worth building into your routine. Use a weekly pill organizer, even if your memory is sharp, because it turns "did I take this today" from a guessing game into something you can simply look at. Set a refill reminder a week before you are due to run out, not the day off, since pharmacy delays and insurance approvals can eat up several days on their own. If cost is the barrier, say that out loud to your doctor, rather than quietly cutting pills in half or skipping doses to stretch a bottle. Many of these medications have generic versions, patient assistance programs, or therapeutically similar alternatives that cost less. But your doctor can only help you find that path if they know cost is the issue. And if you're ever unsure whether a symptom you're feeling is related to a medication change, call the office and ask, rather than waiting to see if it passes on its own. A quick question is always better than an emergency room visit 3 days later. None of this is about fear. It's about respect for how these medications actually work in your body, and the simple truth that your body needs time to adjust, both when you start something new and when you stop something you've been on for a while. The medications on this list exist because they solve real, serious problems. They prevent strokes, protect your heart, stabilize your mood, and manage inflammation that would otherwise damage your body over time. Stopping them isn't inherently wrong, but stopping them without a plan can undo months or years of careful management in a matter of days. If there's one thing I hope you take away from this, it's this: never let a missed refill, a moment of feeling better, or a passing thought turn into an unsupervised decision about a medication like these. A 5-minute phone call to your doctor's office can be the difference between a smooth